guys, we're here again this morning to do a surgery. Now this is not a gynecomastia surgery. This young guy lost about 65, 70 pounds the good old-fashioned way, diet and exercise. But it left him with some loose skin and low nipple position. So what I'm going to do is tighten everything up. Get the nipples up to a higher position, tighten up the skin so it's not just hanging here. So you can see he's got amazing pec definition. I'm just here doing the finishing work. So I'm about to do the markings. Let's get started. So I just finished the markings. So this guy's got a couple of interesting things that I want to point out. Number one, the nipples are at different heights. So what determines where I make this top incision is this one, to make sure that the incisions end up at the same height. But the other thing is, I'll show you this. If I just take out all this tissue here and all this skin, it's going to create a fold that's going to be hard to take care of. So I have to be very careful on what I'm going to actually take out to tighten the skin so the incision ends up along his lower pec in a nice fashion without a lot of fold over of skin here. So I'm done with the marking. So what I'm going to do is head to the operating room and then we'll get going. So about ready to start this surgery. I already marked out the new areola size. It's got to have a lot smaller areolas for this chest. And this is the incision pattern. So I'm going to cut out the areola, put that aside, cut all this skin and tissue out. When I close, then I'll put the areola back on as a free graft. And I'll do the same thing on the other side. So I just removed the extra tissue and skin on this side, and what you can see here is this is his pec muscle. It's really well developed. You can see when I buzz it, it'll jump, and that's how we know it's muscle. What I'm going to do now is close it and bring this up, and then place the nipples as a free nipple graft. So it looks like a lot of space to close, but this will close actually really easily without any tension. So what I'm going to do in this step now is take the nipple and areola that I removed at the beginning of the surgery and thin it down to the level of a skin graft. And so I got to trim all this stuff off so that I can have this as a thin areola so I can suture it on as a graft. So I'm going to start trimming this down. So I just trimmed down the left areola to the thickness I want, and you can see I haven't done the right yet, and you can see the difference in height between the treated versus untreated. So I just got to go and thin out the right side and then graft them on. So finished closing the incisions, really nice symmetric incisions. The main thing now is to put the nipple grafts back on. So rule of thumb, the nipples should always be below the lower border of the pec, which is going to be right here. So you don't want to put them too high, you don't want to put them too low. So I'm going to mark the nipples and then take a look and compare the two sides, make sure they're perfectly symmetric. Just finished the surgery here. Beautiful incisions, skin is nice and smooth, areolas are smaller in the right position. All I have to do is put these specific bolster dressings over the grafts and then we'll be done. He's going to have a fantastic contour. Finally, the finishing work to all the hard effort he put in losing all that weight. So just finished that chest contouring surgery. Beautiful symmetric incisions, perfect nipple graft size and position. Listen, I just did the finishing work. He did all the hard work losing the weight. I can't wait to see his follow-up results. I'm stoked. Until next time, guys.